The atria fill with blood in zero point 0.3 seconds, and the atrioventricular valves, mitral valve and tricuspid valve, open, allowing blood to flow into the ventricles. In the next zero point 0.1 seconds, the atria contract, pushing the remaining blood into the ventricles. As the atria relax, the atrioventricular valves close, producing the lub, or the S1 sound. Then, over zero point 0.3 seconds, the ventricles contract and pump blood into the aorta and pulmonary artery. Finally, in the last zero point 0.2 seconds, the ventricles relax and the semilunar valves, aortic valve and pulmonary valve, close, producing the dub, or the S2 sound. This entire cycle lasts zero point 0.8 seconds and repeats continuously to maintain blood circulation throughout the body.